Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and you also will have to unmute your own microphone.
Good afternoon. Thanks for joining us again. It's not a slow news day or a slow news week for that matter. But thanks for joining us. And earlier this morning, it's not just we that knew, but word got out very fast that we opened up our vaccination appointments to Hoosiers 70 years of age and older. And my first report, late morning, I think we sent that out at 9 a.m. and then late morning it was already topped 30,000, and someone scurried in and said, no, it's actually over 40,000 that have signed up. And I'm sure Dr. Weaver will correct me because I don't even think the ink's dry on my pen marks. But to think about how far we've come so fast, I just would ask for patience when you're scheduling your appointment, if you're eligible, 70 years and older. Because you can imagine, it's almost like a gold rush, but it's a vaccine rush, which is a good thing, and people are rushing. Fortunately, our platform, Zotec, and some of our partners, 211, are accommodating folks who are saying, I want my life back, as you worded it to me the other day. And we're just so happy that people are stepping forward and calling 211 and going to our shot.in.gov to sign up. We have had nearly, what was it you told me, about 100,000 Hoosiers 80 years or older who have scheduled their first appointment in the last 5 days. And so that population was 250,000 that we're separate from our long-term care centers, folks who are also getting vaccinated. And so this is just really an incredible achievement by a lot of people who have come together for a common cause. And it gives us a lot of confidence that the vaccine is getting to where it's intended to be. And that's in the arms of those who are most at risk. And so we're continuing to work our way down. And when I say most at risk, I mean the folks who have unfortunately and sadly, tragically, died and or have been hospitalized, and going down to the 70 range. Now all of a sudden we're able to accommodate a whole lot more of that population, and it's just phenomenal. We've I'm sure you have, Dr. Box, a lot of stories yourself. I've received a lot of input, personal anecdotes about people's experience all over the state of Indiana. It really is heartwarming. We have story after story of people like Mr. and Mrs. Hoffman, who maybe folks can see on their screen now if that photo's been pulled up, who were vaccinated at Hooverwood, living in Indianapolis. But we're getting these reports, and we want them good, bad, or ugly. We want to make sure that we're rushing to any issue that needs to be fixed if it's out there. And so just keep that in mind, that the volume, we went from 80 years or older, 250,000 folks, to 70 now, and that's approaching 500,000. That's like 470,000. And so when you add in all the first responders and et cetera, we're over 1 million
that were invited.
that have been invited to get vaccinated. And so who's 70 years or older? That's about 12% of our state population, 42% of the hospitalizations. And when you go from the 70, that's 80% of our deaths to date. In the past 24 hours, 15,566 first doses of that vaccination have been administered statewide. So we're not flying over any one area. There are sites available. It's a new daily high, but as we continue to evolve, I expect that number to increase.
Adding more slots, available appointments throughout the state, and more options, FQHCs, community health clinics, so people can have more opportunity.
Yeah, and thank you. I mean, you've kept us in this very nimble posture that's enabled us to act and not just hear about the problem, but actually solve problems. So, but Dr. Weaver, as I mentioned, she'll give a full report on our progress. But I think 200. Again, Dr. Weaver, correct me if I'm wrong, but about 220,000 Hoosiers have received their first vaccination, and 40,000, just as importantly, have received their second dose. Lastly, to that end, we're not going to take our foot off the pedal either, and we want to make sure that we're continuing to get this information out. I mentioned the 30,000, and it shot up to 40,000 today who have called and scheduled or gone online. We want to make sure that we're continuing to answer those questions: the who, the where, the when, the why, just as important as anything, that you can get vaccinated. And we've obviously adopted, it's our shot, Hoosiers. And we've got, masks, and we'll have a social media program. We've got radio ads running right now, so it'll be digital. Our television ads, again, statewide, will start to air tonight, this evening. So we're not going to, in terms of administering the vaccination or the communication part of this whole campaign, is truly statewide. And maybe if we could cue up an example of a commercial that you'll see soon.
The COVID-19 vaccine is here. It's safe, effective, and it's our shot, Hoosiers. Seniors, long-term care residents, healthcare workers, and first responders are now eligible. If you or someone you know qualifies, go to ourshot.in.gov, or for seniors, call 211 to learn how you can receive the vaccine. But remember, we need to keep wearing masks and following other protective measures to keep everyone safe. Because it's our shot, Hoosiers. Sponsored by the Indiana Department of Health.
Ourshot.in.gov, 211. It's as easy as that. And with that, I'll turn it over to Dr. Box, and then we'll hear from Dr. Weaver. We'll hear from Dr. Roseniak, Dr. Dan. We also have Chris Johnston from the Office of Management and Budget, and we also have Superintendent Doug Carter, Dr. Carter. There's a lot of doctors around here. Dr. Carter, you're available as well for the Q&A portion.
Thank you, Governor. Good afternoon, Hoosiers. I've talked before about the hope that the vaccine is bringing to Indiana families, and that has been incredibly evident over the past week since we began vaccinating our oldest Hoosiers. We heard from a woman who scheduled an appointment for her 95-year-old grandfather, a World War II veteran. She said her family had essentially wrapped her cherished grandfather in bubble wrap for most of this past year, and that being able to schedule a vaccine at the Delaware County Health Department was a relief to the whole family. We received a story out of Floyd County where an elderly woman broke down in tears when she was told it was her turn to receive the vaccine at the local health department clinic. She told the staff that she hadn't been able to hold her grandchildren since the start of the pandemic almost a year ago, or to go to the beauty salon or out to dinner. Her vaccine this week marked the start of her journey back to what she wants in a normal life. And we've seen the hope reflected across the state in the joy of the faces of our long-term care residents who are receiving the vaccine, and in the applause greeting the nurses coming into these facilities to provide vaccinations. By expanding to ages 70 and up today, we will be able to bring that hope to even more Hoosiers. I realize that this age group differs from what the federal government announced yesterday. I want to again share why we are taking the approach we are. First, we vaccinated healthcare workers and set aside doses for long-term care facilities and first responders. Last week, we started vaccinating Hoosiers 80 and older. Today, we open vaccines to people age 70 and older. Once we open vaccines to Hoosiers age 60 and over, we will have targeted 22.5% of the state's population. But that population accounts for 64% of all of our COVID-19 hospitalizations and 93% of our deaths. Our goal is to reduce deaths and hospitalizations, and that makes this the right approach. Our system is working, and we are going to stick with it. Dr. Weaver will talk in more detail about our continued approach, but I want to be clear about one thing. Indiana has accounted for nearly every dose that we have received in the number of people who have already been vaccinated or who have already scheduled an appointment. We have not been sitting on doses of vaccine, and we never will. We know the federal government has said they will send us more vaccine, but we haven't been told when or how much, or that the doses are on their way. By making vaccine available to individuals age 70 and older, we are continuing our mission of protecting our most vulnerable Hoosiers. And we will continue to expand quickly as we receive additional vaccine. I know how hard it is to wait your turn. We all want a sense of normalcy, and the vaccine will help to get us there. But we're in a numbers game, and still there is not enough doses available in Indiana to provide a vaccine to every Hoosier who wants one. While you're waiting on a vaccination appointment, and even after you receive one, please continue to wear your mask and follow all those other guidelines about social distancing and hand washing that we have been sharing for the past several months. This is more important now than it ever has been before. That variant strain of the virus has been detected here in Indiana. This is the B.1.1.7 variant that was identified in the United Kingdom last September. Indiana is one of at least 10 states reporting cases with this strain. It does not appear that the new strain causes a higher percentage of deaths per cases or more severe illness than the one we've been dealing with. But it is much easier to spread, which could increase the burden on our healthcare system. So while we work to get more vaccines to Hoosiers, we cannot afford to abandon those measures that are proven to reduce the transmission of the virus. And the good news is those same mitigation measures that we've been talking about, masking, social distancing, hand washing, and staying home when you're sick, can prevent the spread of this variant. Our latest numbers illustrate just how important those efforts are. We continue to see a high positivity rate across the state. Our overall positivity rate remains high, standing at 16.1% today. More than 2,500 Hoosiers are currently hospitalized with this disease, and more than 300 people are being admitted each day for COVID or COVID-like symptoms. Today, we reported 59 new deaths. That brings our total losses due to this pandemic to more than 9,100 Hoosiers, when you include the probable deaths that have been reported based on clinical diagnosis. That's an increase of more than 400 in just a week's time. We also have seen an increase in the number of counties in red on our color-coded map. This week, only 19 of our 92 counties are in orange, which is down from 35 last week. The remainder are all in red. This is the map that shows the number of cases per 100,000 residents and percent positivity averaged. Our advisory map, which indicates which level of restrictions counties must follow, shows just 15 counties in orange, down from 27 last week. The rest are all in red. Hoosiers, we still have a lot of work to do. The vaccine is our hope, but it isn't going to provide widespread protection to our communities until we've had a larger number of people vaccinated. So please, stay the course. Don't let down your guard. We will get to the other side of this pandemic. We just need more time. And now it's my pleasure to let Dr. Weaver provide more detail on our vaccination efforts.
Thank you, Dr. Box. In the past week, we have nearly doubled the number of Hoosiers who have received a COVID vaccine. Nearly 220,000 Indiana residents have received their first dose, and the number of people who have received both doses has risen from 585 last week to more than 40,000 this week. If you have received your first dose but haven't yet scheduled your second one, please do that soon. Full protection comes only after you have received your second dose. Nearly 455,000 Hoosiers have scheduled appointments to receive a vaccine by the end of this month, and that number grows every day. To date, nearly 100,000 Hoosiers age 80 and up have scheduled their first dose of vaccine, and nearly 20,000 others have already scheduled a second dose. At the start of the day, 22,000 people have scheduled to receive the vaccine today alone, and I am sure that number is now higher. And also, I do have late-breaking news on the number of 70 to 79-year-olds who have scheduled, and that has climbed to 59,723, 70 to 79-year-olds who have registered for their appointments just today. That's an amazing feat in just 4 weeks' time, especially when you consider that 2 of those weeks had holidays. We have reviewed yesterday's announcement about vaccine eligibility from HHS. As Dr. Box said, it is our goal to expand eligibility as quickly as supplies and resources allow, and that is what we have been doing from the beginning. We are working with local health departments to increase their vaccination capacity. This week, we will ship an additional 20,000 doses of vaccine to those health departments. That is nearly double the amount we were able to send them last week. We are also deploying our mobile vaccination units to long-term care facilities that are not part of the federal pharmacy program, and we will be redeploying those units for mass vaccination clinics in counties across the state in coming weeks. In addition, 38 federally qualified health clinics and 2 community health clinics will be offering vaccinations beginning next week. Those locations and schedules will be added to our map at ourshot.in.gov. We also are working with another 15 hospitals to get them ready to start providing vaccinations. The demand for vaccine is incredibly high. Please do not get discouraged if the location you're looking at has limited availability today. We are working every day to expand capacity and add appointments at sites around the state, as well as bringing on these additional sites. Once you do schedule, it is very important for you to complete the registration process prior to arriving at the vaccine site. You will receive the link in your email or by text, and by doing this, you will assist with the efficiency and the streamlined process that we are seeing at all of our vaccine sites. I will echo Dr. Box's request for patience. All of our vaccine allocations are driven by data. We have been planning carefully for this moment for months. Throughout the process, we have made clear, deliberate choices that are designed to avoid chaos and confusion. We do not want to see lines of people waiting hours outside for their vaccines, and offering a first-come, first-served approach does not protect those most at risk for severe illness or death. When we opened vaccinations to healthcare workers, we were flooded with questions from people wanting to know if they were included. We expect more questions as we continue to expand eligibility. Remember that there are twice as many Hoosiers in the 70 to 79 age category as compared to the 80 and over group. Please know that we all have the same goal, that every Hoosier who wants a COVID vaccine can receive one in a location that is convenient for them. We are working daily to make this possible. We also will continue our work to build awareness of the vaccine so that when their turn comes, Hoosiers will feel confident that the vaccine is safe and effective. We recently sent nearly 200,000 postcards to eligible Hoosiers to make sure they had the information they needed to get vaccinated, and we will be sending cards to Hoosiers 70 and up in the coming days. None of this work would be possible without partnerships from our hospitals and local health departments to other state agencies and all of the stakeholders around the state who have asked, "How can I help?" I'd like to close by circling back to the comments from the Floyd County team that Dr. Box mentioned. On the eve of their first vaccination clinic, Tim Crone from their emergency preparedness operation had this to say: "Tomorrow begins a statewide vaccination effort, the likes none of us has ever seen before. We are literally writing world history, as we will become part of the largest vaccination effort that's ever been undertaken in the history of mankind. Whether you believe in this virus or the vaccine itself, please know that what got us to the point was unilateral cooperation. That's the Hoosier way, and we are grateful for Tim and all of the other heroes across the state who are making this happen.
Thank you, Lindsay. And I think, Dr. Dan, you have an update as you do your soft shoe routine there. Please go ahead, Dr.
Thanks, Governor. So I just want to take a couple minutes to give a brief update on the long-term care vaccination program. That involves both the federal partnership with the CDC and 3 large pharmacy chains, CVS, Walgreens, and PharmScript. I think it's important to first just mention how this program works. This is, as I mentioned, a partnership between the CDC and these pharmacy chains. And the goal is to utilize these large networks of pharmacists and their employees and their experience they have in providing on-site vaccine clinics to have a mobile vaccine force that can go and do on-site clinics at the long-term care facilities in the state. The goal really is to get vaccines to the most vulnerable Hoosiers in the location where they're at. Now, this program right now has been opened up and started in Indiana in late December, and to date, over 1,300 facilities have signed up, and that includes the vast majority of the skilled nursing and assisted living facilities around the state. As a state, we asked the pharmacy chains to prioritize skilled nursing facilities first. This is because of the large number of outbreaks in these facilities and the disproportionate impact on deaths that these settings have had. As such, the pharmacies are on pace to administer the first vaccine in all of the skilled nursing facilities in the state by the first week of February. As of Monday's report, they had been to just over 200 facilities and provided shots to over 11,000 nursing home residents. Right now, there are about 34,000 residents in our 534 skilled nursing facilities around the state. And I should mention, these numbers are likely a significant under-reporting, in part because there is a lag from the time that the pharmacies report the data to the federal database and then the time that we get it. So keep in mind these numbers are likely much higher than what we're reporting. Based on some of the preliminary data that we've looked at, we estimate, or we've seen estimates as high as 70% and higher of resident acceptance in a large number of these facilities. The pharmacies are also reporting that they've administered vaccines to around 5,000 nursing home staff. And while that number seems low, I think it's important to remember that nursing home staff can also receive vaccines at hospitals and in their community. And many of the staff have taken advantage of the flexibility this gives them to schedule at a time and a date of their choosing. In addition, this allows facilities to stagger staff so that not everyone's getting a shot on the same day. The pharmacies program has started off a little slow, we admit, but we've been in weekly discussions with the pharmacy chains, and they have, since the beginning, hired significantly more staff and are continuing to add to their workforce. And right now, they assure us that they will be able to meet that goal of first shots in all the skilled nursing facilities by the end of that first week in February. Now, after skilled nursing facilities, we have asked them to prioritize assisted living facilities. This required the state to allocate more of its vaccine doses to the pharmacy chains, and we did this about 2 weeks ago based on the conversations with these, with our federal partners. And in recent conversations, they've assured us that they should have all of those assisted living facilities scheduled by the end of this week or early next week at the latest. And they have already started vaccinating in many of the assisted living facilities around the state. Now, one of the questions we get a lot is, what does this mean for persons in assisted living facilities who are waiting for a vaccine date now that we've opened up community sites to people 70 years and older? So from our standpoint, what this means is that Hoosiers now have more choice. If somebody in an assisted living facility is able to make an appointment and has the means to get there and back safely, by all means, we encourage them to get the vaccine in the safest and fastest means possible. But we also recognize that because some individuals may have mobility issues or may have health issues that really make it difficult for them to leave the facility, that the federal partnership may make more sense for them to receive that vaccine on site when it is scheduled. What we are committed to is giving Hoosiers the choice to do what works best for them. Lastly, I'm going to mention that there are some skilled nursing and assisted living facilities that, for various reasons, did not sign up for this federal program. And we've spent the last several weeks working with Probari to identify these facilities and to reach out to them to make sure that they had a plan. And for those that did not, we have begun to utilize our mobile vaccine clinics. They are currently out today, and we'll be going to all of these facilities over the next 2 weeks to provide on-site vaccines. And like all of you, we want persons who fall into these vulnerable age groups to get vaccines as soon as feasible. And whether that works best through the federal pharmacy program, through a community site, or through our Department of Health mobile units, we are going to continue to do everything we can to give aging Hoosiers their shot. Thank you.
Thank you, Dr. Dan. Rachel, you want to move right on to the question portion?
Lindsay with WTWO.
Good afternoon, Lindsay.
Good afternoon. How are you all this afternoon?
We are holding strong. How are you?
Good. I'm doing well. So my question is just, how is the vaccine rollout going at this point as far as logistics? And have there been any issues? If so, what are they? And how are you all moving forward to minimize those issues?
Yep. Dr. Weaver, you want to take that? I mean, I'm pleased to date with the reception from Hoosiers themselves and our ability to accommodate. We were very obviously thoughtful about building the infrastructure, making sure the network was in place, making sure that we were connected with all of our affiliates in every of all 92 counties, so that when folks did hear the good news, they were able to get scheduled. And that's what's happening. And Lindsay, I'll leave it up to you to kind of give more detail to that. But I think what I'm most pleased about is the number. If you rewind the tape, Lindsay, about a month ago or a month and a half ago, and looked at all the projections or the numbers that were being thrown out about who would and who wouldn't, in 48 hours in saturation rates, and so I think that's why I'm proud and I'm pleased that we have taken this very methodically, starting with the most at risk of dying and or being hospitalized, and moving as swiftly as we can to accommodate everyone, understanding that we're at the also mercy of the vaccination itself, the inventory. Lindsay, you want to give a little, or Dr. Box or Dr. Dan, I mean, a little more detail about how, not your life, the day in the life of Lindsay Weaver, but how you do, have to shift and call audibles and make sure that we're connected, obviously, to all 92 counties.
Yes, I think the best problem to have is that we have so many people that are excited and interested in getting the vaccine. So something important to keep in mind. So people will, say that they had to wait online for a little while. Maybe they had to wait on the phone to get through to schedule. But the important thing is that people are doing that in the comfort of their own home in their own time. And really what we saw last week is it was pretty short-lived and just occurred on Friday when we expanded to 80 plus. And of course, we've had the same this morning. But, if you don't have the time right now to wait, then please check back later today, check in tomorrow afternoon. We are continuously, like I said, adding sites, adding appointments. So if you see that the place that you wanted to go to is full, then be sure to check back. So our team looks at the numbers every single day and sees where do we have the greatest uptake, who is almost 100% full. And we make sure that we pivot to either add an additional location or send additional vaccine there. So we are moving with the will of Hoosiers, and I'm just really excited that honestly that has been our biggest problem. But we're also expanding capacity with our ability for more people to be able to register at the same time and more people to be able to call at the same time.
Lindsay and Dr. Box, please. But Lindsay, I know this is not a one-size-fits-all approach, and we don't have a standard one answer for each of the different sites, but just for those who are watching, who are probably thinking, okay, if I'm going to be patient because I'm going to get my life back, I don't care how long it takes. Once I get connected, the wait time will be different once you get scheduled according to where you are in the state of Indiana, but you're mindful of that. It could be tomorrow and it could be 10 days from now.
Exactly. So there are some places where you may see that there's nothing available until, for example, the end of next week or maybe even in the following week. But if you're really anxious and want to go ahead and get your appointment done now, look at the other sites around you, maybe in some surrounding counties, somewhere that is convenient to you, and see if there maybe is potentially something available sooner. Plus, you can always, if it doesn't look right for you and you want to come back and check in a couple of days, that's also totally appropriate. I think the really great thing here is that because we have set up this system, once you do schedule and you show up to your site, you will find, I hope, and we've heard this over and over again, it is really slick. It's a 15, maybe 30-minute process for you to get in and get out so you can get back to work, get back home to your family, and do all the things that you need to do.
It's as fast as it can be and still be safe.
And to be safe. That's
Right.
exactly right.
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Afternoon, Governor. Afternoon, Dr. Box and Dr. Weaver and Dr. Siniak and everybody else who's listening. I have two questions. The first, I've been hearing from teachers, grocery store workers who are on the front lines of this saying, when is it our turn? We are, risking our lives seemingly on an everyday basis. So when is it their turn? That was my first question.
Well, we took this, nothing's changed about our not so one-size-fits-all approach, but we are moving forward with addressing the most at-risk population in the state of Indiana and working back from that. We're still in, going through 1A, 1B before we get to 2, but we don't, Brandon, to your point about picking groups, I mentioned a few weeks ago, I've got over 104 letters who are, your words, risking their lives working. We're trying to get to everyone as fast as we can, but we're starting with the most at risk of death and of being hospitalized. You want to add to that, or our phases that we're working our way through? That hasn't changed, by the way.
Right. And I think a big part of it, and I'm sure Dr. Weaver will want to add in, is that we just don't know when we're going to get a big bump in our vaccine dosages. We've consistently been told through the end of January, 79,000 doses a week. And, we schedule even beyond that a little bit, expecting that that's what we're going to get. So if we would find out in 2 or 3 weeks or 4 weeks or at the end of January, as I mentioned, Governor, if Johnson & Johnson did apply for the EUA and all of a sudden we had an additional vaccine, that can really make a big difference. But I know Lindsay's been talking to her advisory committee, and so Lindsay, do you want to comment a little bit more about that?
I think that Hoosiers can see that we are expanding eligibility as a fast pace as we have access to vaccine, and we will continue to do so. And yes, we are reviewing, what makes people at risk, what is their risk for morbidity and mortality, and really, all of the data that we looked at still showed that our vulnerable populations, really based on age, even if they have a low risk of exposure, still had the highest risk of death and hospitalization. So we're really concentrating on these groups now, and we'll just see how much more vaccine will we get in the coming weeks, the coming month, to be able to expand that eligibility to different groups.
And then thank you for that. And then my second question, Governor, for you, after what we saw last week in Washington, D.C., what plans, if any, do you have for a police or National Guard presence at the State House this weekend, as there are protests potentially coming here to Indianapolis?
Yeah, we'll, obviously we are, and I see Superintendent Carter stepping up to the plate, but we will be, Brandon, we will be not just prepared, but ready to do everything that we need to be doing to maintain law and order and to ensure of course, a peaceful expression of opinions. Fortunately, I mean, a lot of the intelligence that we've received has to do with other places as well, but we haven't had some of the same election issues that have been called into question this past November here in the state of Indiana. But having said that, we will have a presence that's appropriate to the situation. Superintendent Carter, you want to give a little more background or up-to-date information to Brandon?
I will, Brandon. Thank you for the question. I think, as the governor said earlier, we're getting really good at shifting and calling audibles in almost everything that we do. And this unfortunate situation is not unlike those many other things. Unfortunately, I have to give you a little bit of a germane answer because I'm not going to certainly expose a very complex series of planning that's been done. I recognize that there's a lot of concern out there, and rightfully so. I really want that to be my worry, not yours. And I can tell you that we've really leaned into what we think and what we know based on what we've seen over the course of these last 6 or 7 days. And it will be all hands on deck, I can assure you. We have a very strong relationship with the Indiana National Guard, with the Department of Homeland Security, both at the state level and the federal level, federal agencies. Many meetings have occurred with the IMPD, with our intelligence folks, and I think we're well positioned. But it's certainly my hope that what we do have positioned doesn't have to be visible. And finally, I have to give a shout out to the process for the vaccine. I went through it personally and at Riverview Hospital, and it was awesome. And a lot of the folks from around the state of Indiana that have gotten the vaccine said from the time of actually registering to the vaccination was absolutely seamless. So, Dr. Box, Lindsay, Dr. Dan, thank you.
Yeah, and I should, just to add to Brandon's question, it was requested, and we have, I have authorized 625 women and men in the Indiana National Guard to go to Washington, D.C. through the 13th, through the 16th, 3 days from now, it's 13th today, 16th through the 22nd to fulfill their national duty as well. But that won't in any way remotely come close to any sacrificing the integrity of our job back here.
Max Lewis, WSBT.
Afternoon, Max.
Good afternoon, Governor. How are you?
Very good, all things considered. Yourself?
I'm doing pretty well, thank you. I wanted to ask a couple questions. My first question is probably for Dr. Weaver. If we're only getting 79,000 doses a week and we have 455,000 people scheduled through the rest of this month, I mean, is there any worry that we are not going to have enough vaccine to get all those people who have appointments and then also give people who've already gotten their first dose their second dose?
That's a great question. So the second dose is not accounted in that. So that's honestly kind of a number that we think of separately. So a lot of what we share is what is first doses. But as far as the number that we're getting every week, so I think it's important. That is what we have been getting pretty consistently for the last couple of weeks and what we have projected to get through the end of the month. But we had bigger boluses at the beginning of the month. So, we are allocated a certain amount in the middle of the week, and then we are able to order those to be delivered at the beginning of the week. And of course, you can't give all of those vaccines in one time. So there is a little bit of carryover to make sure that we cover people until they get their next shipment. So it's really not a one-to-one. And then, of course, we'll see what the next couple of weeks bring as we may have more doses allocated and released to Indiana.
And I also wanted to know, and I'm not asking for you to answer for national officials, but they had said several times that they think that we could have everybody who wants a vaccine could be able to get a vaccine by late spring, early summer, the second quarter of this year. In your opinion, do you think that is possible at the rate that we're going right now?
We are absolutely ready here in Indiana to expand the number of sites, the number of vaccinators, and our throughput on a daily basis to get through whichever vaccine or how much vaccine that we receive. So all of those plans are in action, and we're just waiting to have the vaccine available to do so.
Yeah. Our limiting factor is inventory. We have the network built to accommodate desire.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon. My first question is, as expected, for Dr. Dan. There was a story from Evansville area about a long-term staffer having an adverse reaction and ending up hospitalized from a reaction to the vaccine. I wanted to kind of ask, just generally speaking, about the vaccine, any adverse reactions that we've had reported, and are we having trouble getting long-term care staffers to take the vaccine? I know you said that they could go to multiple locations, but do we have any percentages there? And then I have a second question.
So to answer the first one, I don't have a lot of information on the adverse events. I don't know if Dr. Weaver has any around that. She may make a comment. In terms of the staff, the best estimate we have is really based on an anonymous survey that we did right before the Pfizer vaccine was approved. So we very quickly mobilized the resources we had with Prabari and the School of Medicine to get out a vaccine, to ask staff working in long-term care facilities if the vaccine was available right now, how many would be willing to take it. And at that time, we had about 45% of long-term care, predominantly skilled nursing staff that said we would take it today, but an additional about 25% of them, so a total of 70%, said we would take it, but maybe a little bit later. It's really complicated when we want to estimate the number of staff because, number one, like we mentioned, some are going to get it on site when the pharmacies, clinics show up. Some are going to have gone to the hospital. And some of those staff have had COVID and recovered and may be waiting for their colleagues to get scheduled first before they get scheduled. And some, because they have some immunity from COVID, may be waiting for the second or the third vaccine clinic visit so that they, again, can stagger it out. So we don't have as clear insight into the acceptance rate on the staff. The residents that are on site, it's a little bit easier because right now for those in skilled nursing facility, that's the predominant means by which they get the vaccine. Let me let Dr. Weaver ask about or answer on the adverse.
Or Dr. Box, while she's coming up, you want to
Sure.
chip in on
Sure.
the reaction?
So I know Indiana has had 2 cases of anaphylaxis, which is the more serious allergic reaction, and both individuals did well, but did have to be hospitalized from that. There have been other reported cases of minor type things, some a rash, itching, some not feeling very well, redness or swelling at the site. And those types of things that are reported to the adverse reactions, what we call VAERS at CDC, are getting reported back to us on a somewhat irregular basis. But other than that, those are the main things we've had. We've also had only 11 cases per million of anaphylaxis or allergic reactions through the entire world with this. And although that's higher than influenza, it is certainly not an overwhelming number of people.
Lindsay, anything to add?
Nope, Dr. Box is exactly correct.
Whitney, I think you had a second question, maybe?
Yeah, and I know how much you love to pivot to national politics, but as we speak, our House members are currently doing another impeachment process. I was wondering if I could get your reaction to that process and, whether or not there needs to be some accountability for what happened a week ago.
Those folks that are deciding those proceedings are in Washington, D.C. I'm focused on the home front. Whitney, I'm not running for federal office and won't have an opinion until I would, and don't hold your breath for me to do that. Obviously, we're going through enduring a global pandemic, and I realize we're 7 days away, I guess. It'd be 20th of January would be the inauguration. And what happens between now and then is anyone's guess. I'm certainly, I'm not calling any shots out there and don't want to be. Having said that, what I want to do is be focused here at home, on the home front, and making sure we're getting through this as swiftly and safely. I don't want to just spend my time imagining what it's going to be like to actually take off my mask and not have to put it back on, or going to a restaurant and celebrating the fact that we're on the other side. I don't want to just spend my time imagining all the good that is in the pipeline and that light at the end of the tunnel. It's there now. We don't have to imagine this. We know that vigilance and the combination of vigilance and the vaccine is making a difference. And now we're in this position to where we're starting to predict when that will really make a difference. But we know this is going to save lives. My plate is full, and any other governor in the country ought to be focused on their job at hand. And we know what the results are. We're moving forward. We're already working with our federal and our local partners on making sure we get through this pandemic. The medical science is settled on what we need to, I should say the medical experts have presented us with the information. That's settled. We know what we need to do, and we're doing it. And there are so many indicators, positive indicators out there, both on the health front and on the economic front, that just reinforces me and others to focus on the duty at hand here at home.
Leanne with the Daily Journal.
Good afternoon, Leanne.
Leanne, you should be able
Hi,
to...
thanks for taking my question. I have a pair of questions from a reader. This reader's mother lived. Oh. Can you hear me?
You're bouncing around in and out. Real-time technology issues right here. Full display.
We'll circle back.
Come back to Leanne.
Brock Turner with WFIU.
Afternoon, Brock.
Good afternoon, Governor. Have a couple of...
Okay. I think...
Go ahead, Brock.
Okay, sorry about that. A question here for Dr. Dan and then one for Governor Holcomb. Dr. Dan, I know you mentioned some nursing homes here in the state of Indiana and long-term care facilities did not sign on to the federal vaccination program. I was just hoping you could go into a little more detail about the reasons that you're hearing that those facilities did not, and if you had a direct number of those facilities.
Yeah, I don't want to give the exact number because it may have changed. It was in the ballpark of 10 skilled nursing facilities that were not in the federal partnership. And when we'd reached out to them, some of them had actually established a partnership already with their local hospital and had the ability to do them through them. Some had their local pharmacies that they worked with who thought that they would be able to provide that for them, only to find out later that that's not how the program was designed, but it would be this federal partnership. And so by the time they realized that, the date for signing up had passed. But it's a fairly small number. And in the assisted living facility, it's also in the about 30 or so range that didn't have a plan. So overall, the vast majority of both skilled nursing assisted facilities are in that federal partnership.
Thanks. And then just one quick question for Governor Holcomb. In terms of moving forward in this vaccination process, have there been any instances in which you would have liked things to run smoother? Because I know Dr. Box and others have sort of mentioned, maybe a difficulty with getting the number of vaccines and those allocations changing. Is there anything that you would point to that you would like to see move more smoothly?
I'm a patient individual too. I of course like perfection. But I understand what you're witnessing this is not Cabbage Patch dolls or Tickle Me Elmo, that we're ordering. This is vaccinations to the tune of hundreds of thousands, tens of thousands, not just tests and tracing and vaccinations occurring every single day with multiple partners that is evolving over time. And so I get from the what might seem to be the smallest issue, like the size of a parking lot in some community outstate Indiana, and how that affects accommodating administering the vaccine. So we're all going through this together, like it or not. We're all going through this together. And like I said, we're taking a fact-based approach to moving ourselves not just forward, but through this to the other side. And we're seeking partnerships and building them and growing them, extending them on a day-in-day-out basis. And so there are, the only thing that I would want more of is inventory. That's it. And we will get it into arms when we get it. And I'm not just patient, I'm appreciative that we're in the position that we are right now with inside a year of having multiple vaccinations. You want to add anything? Your phone lights up every minute of every day, so.
I think Hoosiers are just so anxious now that we're on to this point of hope, right? And now Hoosiers are anxious and they just want to know when, and that's the hardest part. And so I think, Governor, you and myself, I know Lindsay, we always just try to be as transparent as possible that these are the facts as we know them, but ask us in a couple of hours and they may be totally different. So we really have adopted that approach. It's kind of the bird in hand. So if we have it, we know we've got it and we'll get it out to people.
And the more that participate in good public health practices and the more that get vaccinated,
Right.
the safer and swifter we'll get through this. And so that's, I guess, Brock, that would be my only appeal is ultimately, in large part, this comes down to personal responsibility. But I'm telling you, our economy and our lives and our livelihoods are dependent on all of us. Whether you're wanting to, do the right thing or not. And the sooner, and we will get through this, to your point, we will get through this. And that's the positive sign and the hopeful thing about this is we know how to get there. So come on board.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. A couple of quick questions. First of all, has your administration considered an executive order that would allow licensed paramedics to administer the COVID-19 vaccine? That's question number one. And number two, it's funny you mentioned do the right thing because there was a hearing today, Senate Bill 78, that would allow for employees with a medical condition or religious objection to waive getting a COVID-19 and the job couldn't force them to do it. But there was no mask wearing. There was very little social distancing. And it looked like the folks there who came to testify were turning the State House into a super spreader area. Who's responsible for that? What do we have in place to deal with that sort of thing as people come to testify, which they should with their government, but at the same time, be cognizant of everyone else's health by wearing a mask and social distancing?
You want to take the paramedics?
Yeah, so the paramedics are able to do that. Dr. Kaufman would love to be here to say, yes, we have got all levels of EMS and paramedics engaged in not only going out to homes where we have homebound individuals and taking the vaccines to those individuals, but on our mobile units, engaged with the Department of Corrections, and also will be engaged on many of our vaccine sites across the state. So we're very blessed to have their partnership.
Yeah, and Abdul, I'll just feel free to jump in, but I'll just say at pretty much the outset of this year and this session, we got a long way to go, and we want to encourage the people to be part of this process. And to do that, we have more than encouraged safe environments, and we're taking the same approach right now during this legislative process. I'll be continuing to meet with leaders and members in the legislative body as they conduct their business, but it needs to be done safely. And what I'm concerned about, to your point, is that folks will seek to shut down or repel or push away others who want to have a contribution in this very process because they want to be safe. And so we'll be making sure that we're working with the leaders, both sides of the aisle, to make sure that they have what they need to ensure that the legislative process can be conducted safely for the people's business to occur. And that's why we're here. And those discussions will be ongoing, I'm sure, as the next 4 months or beyond unfold.
Meredith with WLFI.
Afternoon, Meredith.
Good afternoon, Governor. So I think my first question is going to probably be for Dr. Weaver, but Dr. Box, feel free to chime in. So this is actually from a viewer. We have had people say that they have tried to schedule an appointment, and after entering their birthday, they say they're put into the vaccine waiting room, and then after 60 minutes, they're bumped out of that, and they have to go through the registration process again. So their question is, like, what do they need to do to register? And they're also wondering if they can register with their spouse because they are older and would like to do it together. So that's my first question. And then I do have a second question after that.
Lindsay, you want to take that one?
Yeah, so what they're experiencing right now probably is because of the high volume. So that is one option, would be to wait to a less higher time. So we definitely see our higher numbers in the morning. So I would look in the afternoon or the evening or the super early morning to try and register. It's also a refreshing of the browser. So a lot of IT things. But like I said, we are doing everything we can to try to make it a smooth process. And so more people can get registered at the same time. As far as registering at the same time as your spouse. So right now, technically, you can't put both your names in at the same time and click the two appointments right next to each other. You will have to go in as separate people, but of course, you can do it for your spouse and make sure that you get that same time. But we are working and thinking about improving those functions as we hopefully at some point will be vaccinating entire families. So something to keep in mind, but right now it's not quite that easy to do.
Sure. And then my second question, I know you kind of touched on your plans for if there are any protests. I was just wondering if the state of Indiana has received any threats. I know that a lot of other states, like you said, have kind of had it a little bit more difficult, but has the state of Indiana received any threats, or have you heard that there is going to be any of those armed protests that have been talked about so much?
Superintendent Carter, you want to discuss what we will and won't share?
I will. The short answer to the question is no, we have not. There is a lot out there, though, on social media platforms talking about what might be happening around the state and around every state in the nation. And we, again, are taking that public information very seriously. But as of right now, we do not have any direct information associated with events that could occur in Indiana. But, that could change in the next 60 seconds. We just don't know.
Let me just give add to this. I said at my swearing-in ceremony that these times, as always, but these times specifically present us with a real opportunity that goes along with the real challenge that we face every day. And Indiana has a real opportunity, not just over the next week, but over the next month, 2 months, and beyond, to show that we can have obviously peaceful expressions of our opinions and have debate and do them safely. And so this the coming days, not just the next 5, 6, 7 days, but beyond, presents us with a huge opportunity to show the Indiana way that I believe is on full display.
Eric with WIBC.
Good afternoon, Eric.
Afternoon, Governor. 2 vaccine questions. I suspect the first one is going to Dr. Weaver because it went to her last week, and I have, as it turns out, the same question. So last week we talked about making sure that the second dose is available, and the answer at that time was that that's automatic. The government sets that aside. We've heard from both the Trump administration and the incoming Biden administration that they want to change that. So I have the same question. How do we make sure that the second dose is ready when people come back for it?
Mm-hmm.
So what we are understanding by what they've been communicating to us is that we can trust that production of these vaccines is going very well and will even ramp up over the next coming week. So instead of holding back doses, what we understand the plan to be is that they will release them again with the trust that production will keep on moving at the pace it is, and the vaccines will keep on coming week after week after week. So one of the important things that we are doing here in Indiana is that as much as possible, we go ahead and schedule that second dose on site so that person has a solidified vaccine slot and therefore has a vaccine for them. So every appointment that we have scheduled, we know that vaccine is going to be available for that person, and we will continue to do that.
You had a second vaccine question, Eric?
I did, and I'm not sure who this one goes to. We talked a lot in this hour about getting the vaccine out to nursing homes and assisted living. What about non-assisted senior living? Are there any plans for mass vaccination at those facilities?
Yeah, other congregate settings. Dr. Dan, I think you're moving on up.
So, yeah, right now in the federal partnership, it was just assisted living and skilled nursing and some of the CCRCs. So there really wasn't a lot of the independent living. But as you've correctly mentioned, there's a lot of congregate settings that would contain individuals that would meet the current criteria, either based on age or other risk factors. So what we're doing right now is working with local partners to see what's available in their communities. And as people have reached out to us, we'll evaluate those. And that's what we have some of the vaccine mobile units for, is to go to facilities where individuals are high risk, meet the current criteria, but don't really have a safe means by which they can get the vaccine in the community.
Our final question is from Sarah with WNIN.
Afternoon, Sarah.
Good afternoon. This may be a complicated answer, but I'm wondering if you could tell me how, once you get the inventory that you're craving, how does the state determine the quantity of the vaccine that goes to each individual county? And I know these are data-based decisions, but could you give me any specifics on, is it population, age population, things like that?
That is a fantastic question, actually. Yes.
Yes, that is a great question. And we have an amazing logistics team, planning team at the Department of Health. And of course, we work with our state partners across the state. And really, it is comes down to an exact science. So we know what the populations based on census data for each of these age groups are. We've collected information about comorbidities across the state, as well as critical infrastructure. And so allocations are based on originally on populations and expecting, a certain percentage of people to have uptake in that area. So that's also how we're determining whether or not we're ready to move forward, because again, we don't want to kind of wait for an entire population to get vaccinated before we start moving on to the other. We know we'll have a lot of uptake in the beginning and then it'll trickle off. And so as it's trickling off, we want to go ahead and invite that next group. So our initial allocations are based on that, but then we look to see what is the uptake. So if we see that they're at 100% capacity, they're using up other vaccine slots, but maybe another area isn't. One, we look, why isn't that other area not meeting what their population expectations are? So do we need to do some more work there? But two, we look to reallocate by either moving vaccine, but most of the time it's just making sure we're making those adjustments weekly to get the vaccine to the spots that it's needed.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.